That was the most shocking part of the hospital because they said they would call us so we could come to the wake-up room. That's what it's called in Germany, Aufwachraum, so wake-up room. Yeah, so we could be there when Janine wakes up. That's not the way it happened. We were actually sitting on the outside of our room in the unit, in the children's cancer unit where Janine's normal room was. And all of a sudden the door opens and I just see like 3 or 4 doctors pushing a bed with a kid in it right past me. And all of a sudden I'm like, oh, that's Janine. And she was awake. She was crying, Mom. And then she saw me and she's like, Mom. And just going totally nuts like I'm already used to after an MRI. But this time she had even more medication because it was a really long surgery. So she was totally losing it. And they just walked right past me. I'm like, what the hell? And, sorry. On the other side of our unit was the intensive care, and they put her right in there. And I was running actually to her, just wanting to go with them, and they didn't let me. Please wait outside. I'm like, what? Okay. And they went into the intensive care unit, and I could hear her screaming at the top of her lungs, I want my mom. Mommy, come here, help me, get me. And I was standing outside hearing I was going crazy. Oh my God, I was screaming through the whole hall. I'm like, you guys cannot be serious. Please let me go to my child, but they wouldn't let me. And sorry. When I got to go in, she was already hooked up to all the machines and the blood pressure and the pulse, and she had a little oxygen and her medicine. Everything was just all around her. I have a video of that. I could show you guys sometime. Yeah, and I talked to the doctors and asked what the hell that was about. I was so mad. I was so mad. I was just, I just had that feeling I need to help my daughter. I need to be there for her, but they wouldn't let me. And they said that she was starting to having breathing difficulty afterwards. Maybe it was because she was already awake and her ribs were hurting because they had to cut through them, that she didn't want to go like that, you know, because, I'm sorry, I have a cold. Because when your chest expands, it'll put pressure on your ribs, and it hurt her. Maybe it was because of that, they don't know. But they had to get her to the intensive care unit really fast, and that's why they just ran right through me almost. Yeah, but I can understand why they did that, and they had to do that. But the situation for me, and probably for Janine, was horrible. Yeah, we had to stay a little longer in the hospital because of the breathing problems, because she was breathing just really shallow. You couldn't even tell she was breathing. It was just a little bit, because she was so scared of her ribs hurting. I mean, if anybody's broken a rib before, you know it hurts. Oh my God, it hurts so bad. So she had to blow up this balloon kind of thing, just so she would go, you know, it wasn't more about the blowing, it was more about the, you know. Yeah. So they were just scared she would get pneumonia for not breathing in properly. So we were in the hospital for like 3 weeks. Yeah, that was pretty much the end of the whole cancer story. After that, we had to go to the hospital still 3 times a week, and an MRI every 4 weeks, and well, how it is now, we still have to go in the hospital every 3 months for blood, urine, and her body being checked. And we have to get an MRI done every 6 months. That's okay. We're perfectly fine with that. The next MRI will be in April. There has never been any change in the little rest of the tumor that's in there. Not since the last surgery. So yeah, it looks good. The doctors say if it stays the way it is right now, she could grow old with it. So hopefully, the tumor won't ever grow, and everything will just be perfectly fine. And we'll just do our MRI as often as we can and just let her get checked out as often as we can. And if it stays this way, we'll be happy with it. She does still have a couple of problems resolving out of the surgery. Like her back, she has a scoliosis. Her spine is not, well, if you look at it from the front, it has this S form, and if you look at it from the other side, it's supposed to be straight. Well, hers isn't. It goes like this because of the operation. They had the surgery. They had to separate the muscles from the spine. You know, the muscles holding the spine, like the shoulder muscles and stuff like that. They had to separate that off to get in there, and they don't, I don't know, put them back on there. They just leave them and they'll go back themselves. But by Janine, they just went onto different spots as they were supposed to be. So it's just kind of making her posture a little crooked. So she has to go to physical therapy once a week just to work on her posture. She goes to psychotherapy once a week because we're having a little trouble with her. Well, she's having a little trouble with herself. Like I said, she saw a lot of friends pass away. She had this really horrible time where she didn't know if she was going to die or not. I mean, that's not going to just go away after you don't have to go in the hospital anymore. She still has problems with it. And I call it the princess syndrome. I mean, if you look, I know, if you look at it from the other side, it makes perfect sense, but it's not going to work like that forever. It's just, Janine was always special. When she was 3 years old, she was sick. She was the sick kid. She was the sick kid in kindergarten. She was the sick kid from all of our friends. I'm not talking about the friends in the hospital. I'm talking about the friends we had before the hospital. Oh my God, the sick kid and the sick grandchild, the sick niece and whatever. So everybody was just like, oh my God, this poor sick little child. And if that goes on for years and years, you're going to act that way. She was like the princess, you know, everything had to go her way and everything had to, you know, because she was the poor sick kid. I know it sounds horrible because it really was a horrible time and she was a poor sick kid, but she's not anymore. And she just can't deal with that. And it's starting to be a problem, especially in school. She always has to be the special one. She's always the loud one and the one that's just not working because she doesn't have to. She doesn't get good grades. It's really hard. I mean, it's not hard like it was hard when she was really sick. That was a different kind of being hard, but this is hard too. Because I'm just scared that this cancer story will affect her whole entire life and she won't, I don't know, she won't be good in school or she won't care because she doesn't right now. And it'll just, I won't say ruin her life. It doesn't matter if she's, I don't know, the big shot doctor when she grows up or if she's just like me, like, what am I? In English, an office administrator, right? It doesn't matter. As long as she's happy, it doesn't matter. I just don't want her to wake up one day, like at the age of 16, 17, thinking, if I would have just, I could have, if I would have, you know what I mean? So it makes it really hard for us right now. So she's seeing a psychiatrist, psychologist, whatever. She's seeing a therapist just to help her cope with it all. And it's gotten a little better. I mean, she used to be really violent. If she didn't get her way, she would just slap you upside the face. I'm serious. Not me or not Marcos or anybody, but other kids. She wants to play with that toy, and if you don't give it to her, you will get slapped right in the face. Sounds funny? Isn't. If you get a call like twice a week saying your daughter is scratching other children's faces and stuff like that, it's not funny. But she doesn't do that anymore. That's totally gone. That was the reason why we started the therapy, but she's not doing that at all whatsoever anymore. Now it's just her grades. She just won't work. You can put like a book in front of her and tell her, do that page. She won't. She won't. You have to sit there and say, Janine, this is the next one. Now that you're done with that one, do this one. If you do it like that, she will. But if you just put it there and just say, do it, she won't. Yeah, so it's really hard. Yeah. Well, we'll see. As long as she's healthy, well, as healthy as she's gonna get, and as long as she's happy, I'm perfectly fine with a not that great report card. I really am. I mean, I wish it would be better just to make it easier on her. But the bottom line, if she's happy and if she's healthy, I'm perfectly fine with it. So that was Janine's cancer story. I will do another again. I will do some more videos on this topic, just the slideshow with all the pictures. And as soon as I get all the videos, I will edit it to one longer video and just show you some footage out of the hospital. So it just gets more visual if you see it all. So yeah, if you have any questions, any comments, requests, whatever, just ask me. I'll do a question and answer video if there's a lot of them. Yeah. And if there's anybody out there that's going through this right now, and you feel like you're the only person in the world having to go through this, and you feel like you can't go through this, this is just too hard or anything, just write me a message. I'll answer any question you need because I know exactly what you feel like. Just ask. Okay. Bye, YouTube.